Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na minatapakan pala siya. So, probably, yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made unique from a unique strain of high-grade microalgae known as PPARS. Backed by scientific research, PPARS have shown remarkable benefits in supporting cancer treatment, enhancing general health, and helping to reverse metabolic conditions such as hypertension, diabetes, and high cholesterol. To quickly recap last week's webinar, we tackled a powerful topic entitled Cancer Journey, Your Next Step. It was a very informative session with plenty of great questions well addressed by our expert. And this week, we turn our focus to a deeply important theme because tonight's topic is entitled When to Go for Biopsy, the Signs and Symptoms You Should Watch Out For. First off, a biopsy is simply a medical test where a small piece of tissue is examined under microscope. It's one of the most reliable ways to detect whether something unusual is in the body is harmless or if it needs urgent treatment. Now, many people delay or avoid this test because they're afraid of the result. But here's the truth. Early detection is always better than late reaction. The earlier we know what's going on, the more choices we have, and the better the chances of recovery. So, what are the warning signs or some few warning signs we should never ignore? First off, a lump or swelling that doesn't go away. Another one is persistent pain in one spot. It could be from your neck, could be on your lower back, or also your breast area. Could also be an unexplained bleeding or discharge, right? Non-healing sores on the skin or inside the mouth, okay? Few more changes in mole growths or skin patches. We also have long-lasting coughs, hoarseness, or difficulty or of swallowing. And of course, sudden unexplained weight loss or fatigue. So if you or your loved ones experience these red flags or symptoms, don't just brush them aside. These are signals from your body saying, pay attention to me. And sometimes the next best step is to go for biopsy, of course, depending on the recommendation of your doctor. Of course, so your doctor could get the best and clearer answer. Now, here's where Simply Nature PPARS come into the picture. While a biopsy helps us understand what's happening, PPARS, a plant-based cellular nutrition, support the body in responding better. Yes, they help reduce inflammation, strengthen immunity, and assist the cells in staying healthy. So, think of it as giving your body soldiers the right equipment to face any challenges that may come after the diagnosis. It's technically giving your body an ultimate kickstart or kickoff so that you can be prepared to the upcoming treatment. So, as we move to our discussion, I want you to remember that knowledge is power. Tonight is about empowering you with the wisdom to recognize danger signs early and to make informed decisions for yourself and your family. And of course, I want to encourage you, please don't be shy to ask questions. Whether you're curious, uncertain, or even a little afraid, this is the perfect time to bring it up. Who knows, your question might be one that helps not only you, but someone else listening tonight. So let's dive in together. Once again, our title for tonight is When to Go for Biopsy, and of course, how to stay proactive in your health journey. So leading tonight's discussion, or AMA, are two highly respected experts. First off, it's an honor to introduce Dr. Jansen Kalalan. Healthcare. He is the CEO and founder director of Simply Nature International and PPARS expert from Singapore, but now he's in the Philippines. Mr. Shyan Lim. Good evening, Doc Jansen. Good evening, Sir Shyan.
Good evening, Sheila. Good evening, Tom. No, you
Hello,
look fresh
good evening,
today.
good evening.
You look fresh.
Thank goodness. Thank goodness.
Thank goodness. All
I
right.
thought I was really tired today.
Yeah, me too. Actually, I'm very tired, but it's good that we can still look fresh even though we feel tired. All right.
Yeah, thank
Sheila,
goodness. I think it's new haircut.
yeah, that's true. That's true. That's true. A short haircut always keeps us looking fresh. Sheila, let's go to our questions tonight.
Nice to see both of you, Sir Shyan and Dr. Jansen. For our first question, okay, in using PPARS, is there any required dietary restrictions that we should be avoiding?
Okay, if you're taking PPARS, there's no specific dietary pattern that you have to follow when you're taking PPARS. The diet that you should follow would depend on your health status and your health goals. Okay, but when it comes to taking PPARS, there's none. Even if you eat all junk foods all day, I mean, it's not gonna do any harm. Actually, it would do you good if you eat junk food all day long. No, so yeah.
Yeah, actually, same here, Actually, Doc, I used to be a carnivore until I met you. So before I met Doc Jansen, I really, really love meat. And so I took my PPARS as my vegetable slung, is to counteract my really, how shall we say, poor food choices. But now I'm a little older and a little bit wiser, and of course, my association with Dr. Jansen. So let me encourage everybody. Since you are taking PPAR, why don't you eat foods that will work together with PPARs to help you become healthier, right? And so a simple rule is just eat more vegetables, and if you can get 5 colors of vegetables on a plate, it will be wonderful. So you get your green, your white cabbage, your red carrots, your green vegetables, and if you can squeeze in an eggplant, that's going to be your purple colors. That's just a very simple guide and something that will, make your nutrition complete. Yeah. Sheila?
Thank you, sir. Thank you, Dr. Jansen. All right, next question. Okay, coming from Ms. Maria Antenor. I want to try this supplement. Should I take Cleansing Plus first or go straight to taking this PPARS Plus tablet? I hope we're able to. That's right.
Again, depends on your health status and other things that you're eating or taking, other supplements or medications. But rule of thumb is do not take anything together with the Cleansing Plus, because Cleansing Plus is a fiber supplement that will it will affect the absorption of anything that you take it with. Okay, so if you're taking plenty of supplements, like my cancer patients, they're on a protocol, so they're taking at least 5 different supplements and the medications. So rule of thumb is Cleansing Plus should be taken away from the medications and the supplements. So my rule of thumb for that would be Cleansing Plus should be taken at the end of the day, before bedtime, so at least 2 hours after the last supplement the patient takes. Yeah, so that's my rule of thumb there.
I was going to ask Dr. Jansen, because Cleansing Plus is a fiber, so a good rule of thumb is 2 hours. That means give your whatever you ate before that 2 hours to be absorbed. Is that sufficient, Doc? 2 hours is good?
Theoretically, it's sufficient, theoretically. But everything depends on how fast your stomach is able to empty itself. So if you have a lazy bowel, so your bowel movement is quite slow, then you have to take, it would have to be a longer interval. How long? I don't know. How long? I don't know. Yeah, so in theory, rule of thumb is at least 2 hours, because the stomach theoretically is able to empty itself in 2 hours, empty its content in 2 hours completely. Empty itself. Yeah, so this is in theory, guys. So it would be very difficult to be perfect. to be perfect, it's going to be impossible unless somebody, puts in the camera in your stomach and look, no, is it empty? So I mean, yeah. So rule of thumb is 2 hours. So this is if you're taking plenty of other things that you're taking. Another thing is cleansing plus can also be taken first, no? So sometimes, yeah. So for example, you want to lose weight, you are diabetic, you want to control the blood sugar spikes. So fiber should be taken with your meals. So the medication should now be taken 2 hours after you eat. If you are taking, say for example, melatonin. So melatonin is before bedtime. So take melatonin at least 2 hours away from the last meal, from the time that you took cleansing plus. So 2 hours is the rule of thumb. Okay?
Wow.
So
Yeah.
So if it's very confusing,
2 hours is the rule of thumb.
Yes.
I really want to thank you, because sometimes, even from like Chinese medication, I mean, and many and drugs and sometimes we just want to know, there are a lot of instructions like eat on an empty stomach. So as a general rule of thumb, if you've not eaten anything for 2 hours, maybe make it 3 so that you're really safer. Okay, you have an empty stomach. Oh wow, I've always wanted to know how when my stomach is an empty stomach. So okay, if you've not eaten anything for more than 2 hours, it's a good rule of thumb that you are now under the category of an empty stomach. So if you
empty stomach, yeah.
Okay, good. I learned something today. That's very useful. Thank you, Doc.
Very encouraging. And I understand, Doc Jansen, that sometimes you also incorporate cleansing plus for those patients who are supposed to go for surgery and needs to lose weight as well.
Doc, I have another question. Sorry. If I want to eat chocolate, which I know I'm not supposed to eat, but I want to eat like, okay, just a little bit of like cookies or something. So if I actually take cleansing plus, then I start eating these things like 5 minutes after I finish my cleansing plus, it will actually be not so much absorbed by the body because the fiber will bind it.
Yeah, correct. That's correct.
Oh, now I have a hack.
It's a technique. It's a technique. It's a hack. Yeah.
It's a hack. And of course, after drinking one cup of cleansing plus, you don't feel so hungry. So even if you eat a bit of a snack like potato chips, you won't want to.
That's fine. Yeah.
Oh, wow, that's a good hack. Thank you, Doc. I'm not the only one that's happy to learn about this tonight. Okay.
I'm also curious. So if someone is about to go for samgyeopsal, it would be the same mechanism. They have to.
Yes, it's the same. It's the same mechanism. So if you're in the restaurant, I mean, the food is in front of you. Instead of so they serve you water, right? So you can bring your sachet of cleansing to mix that in the water that they serve.
Oh, wow. No, that's a good tip, because some of these food are like very oily and grilled, so a bit burnt, but it tastes so good. So it's one way, to be able to make sure you don't absorb all the oil and everything. Oh, I think I got my values worth for tonight already. Okay, let's go to the next question, Sheila.
Thank you. Yeah, I actually saw one customer is asking how much is the cleansing plus right now. Thank you. Right. And of course, I just want to say that for those of you who wish to have a consult with Dr. Jansen, for those of you who got confused when to take the cleansing plus, then you can just simply type in how to consult. We'll get into our caring HCS, Ma'am Beth and Ma'am Irish will get in touch with you individually. All right. So for our next question, okay, first thrown to us privately by Ms. Faith. For CKD patients, what is the ideal number of glasses of water per day to be taken? Is it also safe to drink cleansing plus? Good question.
That's a good question.
Okay, very, very good question. Very good question. Okay, for CKD patients, there are a lot of stages. So the amount of water would be dependent on how much you are peeing out. Okay, so if the urine output is still at least 2 liters, then no problem. You can drink at least 2 liters of water every single day. Okay? However, for CKD patients wherein the urine output is diminished or you are manifesting symptoms of congestion, for example, edema. Okay, you are both of your legs are edema. You have to go see your doctor first, your cardio, and nephrologist specifically, so that they would be able to calculate how much water is only allowed for you. Okay, so there's a calculation there, but usually, rule of thumb is the amount of water that the patient is able to pee out should also be the same amount of fluid that you should be drinking. Okay, that's rule of thumb. So there would be patients who would have smaller requirements. There are also CKD patients wherein there's no limit on the water that they drink. Okay, so it depends. So the answer to the question is consult your doctor, especially your nephro and your cardio. Okay, those are the two specialists to ask.
I have a follow-up question. This is just very curious. Today we are really asking about our GI. When we drink water, as a healthy person, the glass of water that you drink, how fast before it comes out as urine? I just also want to say, in the military, they make us do these water parades, which they make us drink like 4 or 5 liters. At that point, right, whatever you drink is gonna come out almost immediately. But let's say you're not at saturation point. That means so if you drink a cup of water, usually in general, how long does it take for water that's not absorbed by your system to come out?
I don't know the answer to the question, but there are a lot of factors. There are a lot of factors. So first, the hydration status of the patient at present before drinking the water. If the patient just ate a high salt meal,
okay, that's true.
Was the patient sweating a lot? Did the patient exercise? Is the patient at rest? These things, there are other things as well, but these things can influence how fast the water would be eliminated in the body. The water that the patient just drank. Okay, so but I mean, this is purely academic. As long as you're able to, there's no limit in drinking water, then go ahead and drink as much as you can.
Yeah, I was actually asking this question for any CKD patient who was probably thinking, how do I calculate how much water I release a day? So I think the final answer is go ask your nephrologist how much you can drink. I think that's the same answer Dr. Jansen gave just now. All right, thank you, Doc. Sheila?
Thank you, Doc. Thank you, Sir Shyan. All right. Well, earlier we've asked what are the foods to avoid, but that's on a general note, whether you have illness or not. But right now, coming from Ms. Rita Melendez, the question is, what food to avoid while taking PPARS if you have breast mass?
Okay, the breast mass would have to be, we have to diagnose the breast mass first. Is it cancer? Is it benign? So the answer to this question would determine the food that you should be eating.
Yeah.
Okay. Yeah. Okay.
If you want to be safe, that means you went for a test, you don't know the result yet, then the answer is stop taking meat, right? And eat more vegetables. Yeah.
Yes.
Once you're diagnosed as a cancer patient or a benign mass, I suggest have an appointment with Dr. Jansen so that he can advise you what else you can do to remove the mass, even if it's benign.
Exactly. Thank you. Thank you, sir. Thank you, Dr. Jansen. All right. Next question coming from Mr. Ronald. Question is, for atopic dermatitis, is taking the tablets enough or should I take the extracts? What extracts is recommended?
It really depends on how bad the atopic dermatitis is. So some patients, tablets are enough, but there are patients wherein we really need the extracts. However, that's only fixing inside. Ultimately, what you want is immediate relief of the lesions. So I would suggest try the AD Pro. So that's one. Another thing that you can use, at least for the soap, is Dove Sensitive. The soap should be no fragrance, no alcohol. It should be very, very soothing to the skin. So Dove Sensitive soap is one that dermatologists usually recommend. the type of soap. Another thing that you can consider is vitamin D. So some patients who have atopic dermatitis are vitamin D deficient.
Wow, yeah.
So we can test for that as well. No? So for the PPARS, if you're looking for a protocol, at least the soft gel. You should at least be on the soft gel. Yeah, but if you're someone who's, budget constraints, then try the tablets first. Then if it's not working there's no significant improvement in 1 or 2 months, then increase the dose, add in some of the extracts like the soft gel. Yeah. But ultimately, you have to be on a protocol, not just, getting snippets from the internet and trying to experiment on yourself. No, that's not good. It's not a wise decision. That's not a good thing to do. Yeah. So that's my take on it. Yeah.
I just second everything that Dr. Jansen said. If you are a AD patient, then I would really start with the soft gel capsule. All right. And not knowing whether you're very serious or just moderate. All right. And I would do at least one soft gel capsule a day, or even two, one capsule twice a day. And how fast before you see results? If you have very serious AD, you will see results faster in the sense that you will feel more relief faster, right? Because if your AD is more mild, your irritation is less acute, less serious. But if your AD is very bad, then you might be bleeding, you might be your pus open wounds. So those you will see the effect of the PPAR soft gel much faster. There was a doctor in Region 5 many years ago, about honestly more than 12 years ago. The doctor was taking actually very serious, and he was just taking tablets, but he took 20 micro tablets on the first night that he got the thing. And this is what he said. It was the first time in 14 years, 1-4, that he was able to have a good night's sleep. So apparently his psoriasis was so bad that it was very difficult. Every night he had trouble having a good night's sleep. So again, it varies from patient to patient. So, but we are quite confident, if you do the soft gel, you see results. Yeah. And if you're really on a budget, right? If you're really on a budget, you can try the tablets. It will definitely take longer. Take about a month to see the improvements. And the AD Pro is wonderful. Thank you, Doc, for bringing that up. Because for anybody with atopic dermatitis, AD, that on your face, right, there is a lot of limitation. You can't, even your dermatologist will try to minimize using steroid creams on your face, because your face, the skin is very thin and it will enter your bloodstream, right? So it's not advisable to use strong steroidal creams on the face. The AD Pro is actually absolutely safe, even for everyday multiple use a day on your face. So this is really a great product for AD patients on the face, especially this, I'm sure, will be very exciting for ladies who are suffering from psoriasis. Yeah.
I'm just curious, Doc Jansen, is this AD also possible for babies to
Oh yeah.
Yes, they're so common in babies.
Yeah.
Then
Yeah.
And for everyone's knowledge, information, the AD Pro is food grade.
Yes.
FOOD, food, right? So if your baby touches his own face, then licks his hand, you don't have to worry like if you put steroid creams or any other medication, right? You don't want your baby to take the topical application, because most things that you apply on your face, you're not on skin, you're not supposed to eat it. All right, so this is really a good solution for kids. All right, kids. So even diaper rash.
All right. I just cannot imagine moms waking up at night because their babies are crying and because of discomfort. So yes, AD Pro can help, definitely. All right. So just before we go to our next question, just want to greet our viewers for tonight, starting up with Miss Marive Bongay, Miss Leonila de la Cruz, Imelda Oracion, and Ma'am Helen Kamanayan from Baguio. Magandang gabi po. All right. For our next question, coming from Miss Jing Piana, I have fatty liver, high cholesterol. Does taking one capsule of this product will help to normalize results? I'm keen for your.
Not immediately. Um, Fatty liver, high cholesterol. So if you have fatty liver, that means you're consuming too much sugar, high sugar foods, and saturated fats. No, so the saturated fats is a type of fat that is present in cooking oils, meat products, processed meat, processed foods. So if you're consuming those, then yeah, I won't be surprised to get high cholesterol and fatty liver. Number two, if you're consuming very high sugar foods, very sweet foods, especially processed foods, processed carbohydrates, so like your bread, pasta, refined grains like your white rice, chips. Okay, so if you're consuming very high amounts of these foods, then yeah, no wonder you will have fatty liver disease. For high cholesterol, there are a few things that we have to take into consideration. Not all patients who have high cholesterol have a good diet. Okay?
Yeah, that's interesting,
Cholesterol
bro.
is a yeah. So we have to be careful about this, no, especially in prescribing statins, because if a patient has high cholesterol, it can mean two things. Either the demand for cholesterol is high, that's why the liver is producing higher amounts of cholesterol, or you're eating a bad diet. That's why your cholesterol is high. Okay? So we have to distinguish between this. How do we distinguish this? No, we have to request for a test, what we call as ApoB, apolipoprotein B, and apolipoprotein A1. So ApoB is a subset of your LDL particle. LDL is your bad cholesterol. So you request for your lipid profile, you have there LDL. So that's what the cardiologists are saying na this is your bad cholesterol, LDL. HDL is your good cholesterol. So LDL, why is it bad? Because that is the one that deposits plaques in your arteries. So the one that is responsible for plaque deposition is ApoB. So there's a test to test for that. So ApoB, if that is high, then of course it's high because you're eating a bad diet. Okay, so we have to correct the diet. So if your cholesterol is high, but ApoB is low and your ApoA1 is high, then that means the demand for cholesterol is high. Okay, so we don't have to start you on statins. Just make sure you're on a good enough diet, and we have to take a look at your hormones, because cholesterol is a precursor, is a requirement for hormone production. So if you have hormone imbalance or if you have inadequate hormone production, then your liver will produce more cholesterol. So it can manifest as such. Okay, very important to distinguish. Okay.
Wow.
So there you go.
Wow, that's a very, very interesting insight that the body will produce more cholesterol because there's a demand for it as well. And that could be a result of hormonal imbalance. For the persons who are trying to manage cholesterol, fatty liver through the protocol and product, I will let you know that it will have effect. All right. Now, to what point can you normalize your cholesterol and improve your fatty liver? It will really depend. I can give you a simple advice, which is take Simply Nature PPAR capsules. If you are fatty liver, I assume the fact that you know that you're fatty liver, that means your doctor has been giving you a warning that you have fatty liver, do something about it, right? Or else normally you wouldn't go and test and know that you have fatty liver. So for that reason, I would just say soft gel capsule 1 month together with tablets, and then after that you can just check your results again, and if things have improved, you can actually just continue with the tablet and give yourself time, right, to improve. The minimum for tablets for therapeutic is you got to take at least 10 micro tablets 2 times a day or 3 times a day, all right? And for those of you with blood cholesterol issues, I want to encourage you. Doc Jansen has a fantastic record, and he has helped many, many patients manage and literally over time, not overnight, get off their maintenance meds. So this is something that Dr. Jansen can really do. In fact, I remember about 4 years ago, I was talking to Dr. Jansen. He's actually upset. Yes, he was actually upset because he says he keeps seeing these patients, same patients coming back with cholesterol problems. It's like it's not helping. And then all he can do is increase the dosage of their medication. But since then, Dr. Jansen has found a great combinations of different protocols, including PPARS, that he can help patients really manage their cholesterol well and even go off their maintenance meds over time. So if you've been struggling with cholesterol for a long time, I would suggest you have a consult with Dr. Jansen. All right, and he will probably use our either soft gel or combination of soft gel and tablets together with other protocols to give you the results, and you can go off your maintenance meds. Maybe around, doc, for a person that's not too serious, 3 months is a safe time that they can actually wean off their maintenance meds.
Possible.
Yeah, about there. All right. So Sheila.
Okay. Thank you, sir. Thank you, Doc Jansen. Okay, for our next question, coming from Mr. Joseph. Okay. Had prostatectomy last 2016 for prostate cancer, but recently benign tumor found again in prostatic bed where prostate was removed. Which PPARS is for me, and it will not occur and lessen the inflammation and kill the circulating tumor cells?
Okay, PPARS is not meant to kill the circulating tumor cells. Okay, so it doesn't kill the cancer cell. So what it does is it improves the immune system, immune function. So the immune system is the one that will kill the cancer cell. Okay, so for your case, the approach for this is to, number one, establish that the tumor that was found is malignant or not. But if you said it's malignant, if it is benign, then the next step would be to make sure there's no circulating tumor cells in your body relative that is related to the prostate cancer. So we have to have a testing first. So the test would be a liquid biopsy, which is done by RGCC. The name of the test is OncoTrail. The OncoTrail test is specific for prostate cancer, and it measures circulating tumor cells. And once the circulating tumor cells are isolated, we will be able to know if it has a high propensity to metastasize, if it has cancer stem cell characteristics. So these are the things that we would be able to know from this test. Then from there, we would be able to know what supplements to give to help reduce the stemness characteristics. Now, if you want to kill the circulating tumor cells, there's a separate test for that, which is the onconomics. So the onconomics will tell us, onconomics plus test, that will tell us the drugs and the natural extracts that can be used to actually kill the cancer cells. Then we can submit sample of simplynature PPARS to RDCC. So RDCC can test it against the cancer. So we can do you can do it that way. So this is because we have an actual measure of what we are trying to achieve. Okay, so we know how much to start, how long to take, and what to take. So these are the big questions, very important, no, that we are able to answer. So that to help us answer these 3 questions, you have on-trail and the onconomics tests. Okay? So yeah, that's the proper way to approach this case. Now, would it be helpful if we just test for PSA? Yes, because for patients who underwent prostatectomy, the PSA should be nil. It should be trace amounts only, close to 0. Okay, because you don't have the prostate anymore. There should be 0. Now, if there is some PSA, there is some amounts of PSA in your blood, and it is increasing. Okay, so the trend should be increasing. Then that can be a sign of recurrence, and we can base it on that as well. So response to treatment, in other words. But if the PSA is the PSA levels is relatively flat, it's not changing significantly over time. Then, I mean, the tumor that was found is really benign. So I mean, I won't be touching this at all. So just leave it be. In other words, yeah. So that approach can be done. But the second approach, which I described, would be kind of train darts on a blindfold, so to speak. So you only have you only know the general direction on where to throw your darts, which is in front, but you don't know if you're actually hitting something, yeah, or where you're hitting, yeah. Okay.
You know,
So
this is very interesting because in the recent years, the liquid biopsy is really a great new diagnostic tool to help cancer patients who have recovered from cancer, where all their other diagnostics say that they are clear. For all the cancer patients who are listening, it's something that is good to take note. Even though all your cancer markers are clear, many oncologists, depending on your cancer type, I guess prostate is the slower cancer, so maybe not as often. But for other more aggressive cancers, or your onco will still prescribe 1 or 2 sessions of chemotherapy as a, how shall we say, preventive chemotherapy, just to clean up, to check if there's any residual cancer cells in your body that escape, are too small to be detected by the other tests, right? So now that we have a new tool, a new diagnostic tool called liquid biopsy, that can look for circulating cancer cells. I think that's a wonderful tool to give peace of mind to a cancer patient, and that you could do it once and then maybe 6 months to 8 months later do another one, even though you're feeling very healthy, right? Because that could be deceptive, and that will really give you peace of mind and also allow you to really take the right protocol to prevent recurrence. There's so much into this topic. Yeah, I'm sure we'll talk about it when the right case study comes up or right question comes up.
And of course, for those of you who wish to have a consult with Dr. Jansen, simply type in once again how to consult, so we can get in touch with you individually right after. Now,
Yeah, I just want to add one more thing, right? It's just that I think Dr. Jansen and I just want everybody to know there's more that we can do now that can give you peace of mind and make you even more clear. Because I'm sure to all cancer patients, you have heard this story and testimony before, which is someone has been declared normal. That means their cancer marker, everything is back to normal. And then 3 months later, 6 months later, the cancer came back. And we are all scratching our heads, right? How come 6 months ago, everything was clear, the scan was clear, my blood test, blood works came back, everything was clear, then how come the cancer came back? The answer is, that means the cancer was still there, but not detectable because it's too small. And what Dr. Jansen is just introducing is there's an improvement, there's a new tool that can allow you to detect things that in the past was harder to detect. All right, and that will give you peace of mind and an important part of the strategy. Now, when to take this test, at what time do you space it out, and what to do after that, go for a consult with Dr. Jansen, all right? Because then your individual case details will come in order to give you a really good advice. But at least you now know there are new tools that will make the fight against cancer much more successful and make sure that recurrence doesn't occur in your case. All right, so have a consult with Dr. Jansen, especially for those who have finished your cancer treatment and you want to make sure that it doesn't come back. Talk to Dr. Jansen to check with him what you can do next to make sure that you have peace of mind, what to do 6 months from now, what tests you can do to ensure that, yeah, you really are clear and that you will stay clear. Sheila?
I just actually want to share because a few weeks ago, Dominic had his surveillance checkup in his hospital. So I was reading the bulletin board, and I saw one of the events for the oncologist, and I've really seen some of the topics there. 2 notable topics were included, which one is liquid biopsy and one is actually immunotherapy. So it's nowadays it's really not surprising that these are very much incorporated now in the hospitals. But what I just want to say that you are in the right place. You are watching the right program. for
Wow.
later.
So for those of you who don't know what Sheila said, doctors have weekly lunches.
Conventions.
Yeah, where they share their case studies and they also upgrade themselves with new things, right? So on a weekly and worst case is monthly basis if they are really very cramped for time. But I believe it's a weekly thing. So so liquid biopsy is now being brought up as a topic for awareness and for discussion and for sharing how it's being applied. So that's good news to everybody. Yeah.
Yes, and
And Dr. Johnson, you heard it here first, huh? From Dr. Johnson. All
yes,
right.
and immunotherapy, which of course PPARS is categorized. So,
Yeah.
all right, for our next question coming from Miss Christine Banog. Okay. Is biopsy needed for BIRADS 3, probably benign result of ultrasound?
Very good question. Okay, I have two answers to this. I will share with you the answer if you follow the guidelines and my personal answer. Okay, so I'll share with you the guidelines first. What the guideline tell us. Okay, so guidelines wise, a biopsy would only be needed for a BIRADS 3 category mass. So if it is increasing in size. Okay? If it is increasing in size. Now, if you want to take one step further, okay, if you want to take one step further on being, careful, proactive, then you can opt for a biopsy. Because the biopsy is the one that would tell us what that tumor is. Is it really benign or is it malignant? Because all malignant tissues, all malignant tumors start out as benign looking. Okay? They start out as benign looking. Then eventually, while we're monitoring, they eventually turn malignant. Okay? So, all malignant tumors are like this. Now, there are tumors, no? I mentioned there are tumors initially benign, then suddenly it becomes malignant. So, is it an actually truly benign tumor that actually become cancerous? No. Okay. It can happen, no? Benign becoming malignant, truly benign becoming truly malignant tumor. It can happen, but it is rare. It is very rare that it can happen. So if a benign tumor on ultrasound, okay, becomes malignant on biopsy, then the benign finding on ultrasound is not truly benign. It was already malignant to begin with. Okay? Okay, I hope you understood. So my take on this, if I follow the guidelines, I would biopsy this. My personal answer, if it is small enough, I would have this resected, regardless of the BIRADS category. Even if it is BIRADS 2. BIRADS 2 is benign. I would have this removed. Okay? So this is my personal take. Okay, this is me. Don't follow me. Okay, because this is just me. I still have to see your history before making a proper recommendation. But yeah, if it happens to me personally, that's what I would do. Okay, so I hope you understood that answer. Okay, so for everybody's education, okay, is biopsy needed for BIRADS 3 category breast mass? My answer is yes, if you want to be careful. If you are quite apprehensive on biopsy, or anybody poking needles or touching your body, then you can observe. Observation is perfectly fine at this stage. How often do you observe? It's every 6 months. Every 6 months for 2 years. Then once you have all the 4 ultrasounds are still benign, the size is not changing, you can do it annually thereafter. Okay, so that's one approach if you just want to watch and wait or observe first. Okay, so I just shared you 3 approaches. Okay.
And Dr. Jansen will actually have it removed if it's small enough. So that's how a doctor is thinking. So that's something that's a personal approach. That's something you can really consider. And I think that will make going for the biopsy basically a strong recommendation. Again, this is based on education, not your specific case. We can't make any recommendation for your specific case because we don't have all the information. And I think Dr. Jansen has also answered another question which someone else asked. Can a benign tumor become malignant? The answer is
Okay, good.
yes. The answer is yes, but it's very rare. So if you ever had an ultrasound that it showed that it was benign, and then the next week you do a biopsy and it turns out to be malignant, it doesn't mean, it most likely means that it's not that the benign tumor became malignant. It's probably because the ultrasound did not give enough resolution or clarity to be able to diagnose that it was malignant. It was already malignant now, but it is still possible for benign tumors to become malignant, but in general that is rare. Am I correct, Doc? In general, that is rare.
Yes, correct. Yeah, that's correct.
Okay. But the only problem is if it was misdiagnosed, that means it was not malignant, it was not benign, it was actually malignant, but because of the ultrasound, the interpretation was wrong. It was interpreted as what's that called? Benign. Then that's a terrible situation because you lose time when it was actually malignant. All right. So again, if your doctor or the diagnostician actually recommended for biopsy, is something that is worth to really take it seriously. Of course, if you're in doubt, the solution is not to do nothing. The solution is find a second opinion. So if the second opinion also say go for a biopsy, then go for a biopsy. Yeah.
Thank you. Very good question. All right.
Yeah, very good question.
Our next question coming from Ms. Dolores. Okay. Interesting one. Why do some people immune system destroy cancer cells while others don't?
I also have the same question. I also have the same
We
question.
also, yeah. If we can answer
Why
that,
does it
it cure cancer.
When does it happen? When does it happen? I actually don't know.
The most difficult one is sometimes the person who has cancer is the one that it goes for jogging, eats healthy, and the one that doesn't have cancer is the one eating junk food and unhealthy, not exercise. There are cases like that too, and we scratch our head as well.
Yes. Actually, this is a very interesting question. Why do some people's immune system suddenly is not able to detect the cancer? So there are a lot of theories that a lot of researchers are suggesting, but the one that seems to be, well, for me, one that can explain every stage of cancer occurrence, promotion and progression, also causing resistance to treatment. Just being stubborn and causing a lot of problem to the patient is a fungal infection. So they say that fungal elements hijack the cell's DNA. So the DNA will mutate, and once the DNA mutates, it affects different aspects of DNA repair mechanisms, all these things, in such a way that it causes progression or unlimited replication of cells. So you have cancer in that sense. And once the cancer is already out, the cancer also mutates, so it adapts, and so that it can evade the detection of the things that kills it, also known as your immune system. So we have a test, no, to check for this, which is the PDL1 status. So PDL1 is programmed death receptor ligand 1. So if this is positive, if this is positive or reactive, then that means your immune system is evading detection of the immune system. So in that case, no, there are medications that we can prescribe to the patient. So the patient's immune system can detect the cancer cells again. So these are your immune checkpoint inhibitors like your Keytruda or pembrolizumab. This is the one that is very common here in the Philippines, no, used quite commonly here in the Philippines. So so that's one explanation. Now, why do we have mutation of the PDL1? I don't know. I don't know, to be honest. I don't know. So I mentioned fungal infection or fungal elements, no, causing this. So in integrative oncology, we actually use or repurpose a drug called itraconazole to address this. So how do we know that the patient has fungal infection?
Yeah.
We take a look at the nails.
Okay.
So if your nails is, it's not looking like a proper nail, then that can be a sign. Okay.
Okay.
Another sign is inflammatory signs and symptoms. So we have a questionnaire for that. So these are signs and symptoms that are quite non-specific, but if you have enough of them, then the suspicion of fungal infection is higher. So we have a scoring system for that. Also, if it's quite difficult for a physician to get a hold of this questionnaire, or if you actually don't know what to ask, for doctors who are listening, then you just have to ask the patient, are there molds in your house? Because if there are, then chances are the patient is infected with fungus, with mold. The patient has mold toxicity. Then you have to detox the patient. Because if you don't detox the patient, no matter how much you treat, the patient is not going to get well. Or the cancer would be quite resistant to treatment. So, you have to ask these things so we are sure that we are hitting the right targets.
Yeah. Doc, I also wanted to say that another factor which I find is very real is your emotional state. If you under duress, under stress, if you are, for example, you're so angry with someone who betrayed you or something, and you are filled with I can say, because I've actually been hurt enough to want to hate a person, We've all been there at some point or another. And it does, even if you are a jogger, eat healthy, but if someone did something to you and you're filled with hate and bitterness, your immune system really gets compromised. Really, really. And even if you are a regular exerciser and whatever, and you're generally fit, if maybe over a short period of time, for me, I'm generally fit, but if I go for 3 days of all-nighters, pulling a stressful conference or something like that, after the 3 days, I can catch a cold a lot easier, right? I don't know. I don't think you can develop cancer just like that, but I think emotional duress, which, like, for example, unforgiveness and bitterness, is something that we hold a lot longer than just 3 days of a conference and sleeping late, So I do think that emotional states can really lead to affect your immune system's ability. And like what Dr. Jansen says, cancer is developed not because your immune system can't kill the cancer. Most of the time, cancer is developed because your immune system can't detect the cancer, right? The moment your immune system can detect the cancer, it kills it. And that's how modern immunotherapy actually works. Immunotherapy doesn't kill the cancer. It helps your body detect the cancer. Then your body does the killing. Yeah.
Thank you, Doc Johnson. I'm just very curious, very quickly. Doc Johnson, this PDL1, is it like taken just by blood extraction? That's it? Oh.
No, it has to be biopsied.
Wow.
It has to be tested through a biopsy. So you get a tissue sample, then the pathologist, laboratory people would test this tissue sample for PDL1 status.
Thank you, Doc. It's
Well,
good if you're...
there's an exception.
Mhm.
There's an exception. Uh, liquid biopsy can detect this. Liquid biopsy can. So you get a blood sample of the patient. You isolate the circulating tumor cells. You can actually test for PDL1 on the circulating tumor cells. RGCC can do it. RGCC can do it, but it has to be onconomics. The onconomics test. The onconomics test is the more expensive one. The oncotrace and oncotrail, they can't detect this. Yeah, so they won't be testing for this. So it has to be the onconomics. Yeah. Okay, so
I just want to say, the fact that you brought up fungal infection is very interesting because HBO has a hit show called The Rest of Us, which is based on
yes.
based on a super hit console game.
Cordyceps.
Yeah, and in that show, the showrunners were explaining that if you get fungal infections, it's very difficult to treat and almost like no solution. So if there was ever a fungal pandemic, many people would die. If the fungal infection can actually kill, it's unlikely that we will be able to treat it. Wow. So just something that you brought up, I thought just a little bit of trivia, right? Yeah, the cordyceps, right? They became like cordyceps. Yeah, crazy. Oh yeah, sometimes Doc, Bill Gates is always warning us of the next pandemic, and I think sometimes it's best not to know, or else we'll be afraid of everything. But yeah, there are really a lot of medical threats out there. Yeah.
It's really good that we are talking about this, and you've mentioned about molds. We are in the season of
rainy season.
Rainy
That's
season.
right.
A lot of us are using wood materials inside the house, so you might want to think about
yes, if you can smell the mold in your home, it's not a good idea. All right, try and do something about it. Yeah.
Well, thank you, Dr. Jansen. Thank you, Sir Shyan. Okay, very interesting answer.
I think just a few last questions, two last
Yes,
questions. We've actually
will
been
do.
answering for an hour. There's always next week, everybody. There's always next week. Yeah.
Well, the viewers love you both. All right. So for second to the last question coming from Miss Francis Faith, what is your take on cyberknife?
Oh,
Cyberknife
interesting.
treatment on breast tumors. Wow.
Always
Good question.
really good questions. So every single week, we've been doing this for how many years already? 3, 4
Almost
years.
five.
Yes,
Five.
almost 5. Oh my goodness.
Wow.
Okay. Cyberknife. So for everybody's info, no, Cyberknife is a brand. Okay, so that treatment is using high intensity radiation to cut through tumors.
It's not
That's
actual
what it
knife,
is.
huh? It's not actual knife.
Yeah, it's not an actual knife. It's like a lightsaber. For those of you who are Star Wars fan, no? So it's like a lightsaber. So that's the one that you use to cut through the tumor. Now, cyberknife treatment, it's also known as your stereotactic body radiation treatment. It's like your SRS, but SRS usually we use it for hitting brain nets or brain tumors using radiation. But this one is on the body. Okay, so for cyberknife treatment, they say that it is almost equivalent to surgery. Almost equivalent to surgery, and the precision is really precise. That's what I want to say. It's really precise. Okay, since you're using light to cut through the tissue. Now, the only thing that I would be of concern, that the only thing that would be of concern is the radiation itself, because it's radiation therapy. There would be fatigue inflicted on the patient. There can be radiation burns on the skin, so you have to have proper skincare after, and number 2, you have to have proper, supplementation to recover from this procedure. But the recovery for most patients, the recovery is quite it's not that long. I mean, after a month or 2, patients would be, up and about, back to normal functioning. with this procedure. Now, when would be a good time to use CyberKnife?
Yeah.
I don't know. You have to ask your radiation oncologist or ask ChatGPT. But there are a lot of options no, nowadays. So you can undergo the usual knife surgery, open you up. Can undergo this kind of treatment. This kind of treatment, though, no, you have to compare costs. No, the regular surgery is cheaper compared to stereotactic radiosurgery. Okay, like cyberknife treatment. Cyberknife treatment is really, really expensive. Okay, so yeah,
I
so
have a
those are
question.
the.
I have a question. Right, when we do surgery, we want to take something out, right? So
Yeah.
since the cyberknife, you don't actually cut anything. So does it mean that? So is traditional surgery still having an advantage because you actually take the thing out, or and cyberknife I guess you literally kill it while it's in the body. So it is traditional surgery if it's not complicated, if it's simple, that means it's a clear path to the thing that you want to cut out. Would you opt for if money is not the issue? Would that be a situation where you think traditional surgery will be better than cyberknife? Yeah.
Me, yes. The traditional surgery, I would still prefer the traditional surgery. Why? Because the doctor would actually be able to see what's inside you.
Oh yeah, wow, that's a good point. In
Yeah,
a cyberknife,
physical.
it's just
Yeah,
like imaging, right? You don't actually see.
yeah, yeah. Direct visualization is still very important. Number two, if there, so here, this would be the pros and cons, no?
Okay.
Regular surgery, it would be good because guidelines, all our cancer treatment guidelines, no, is based on the traditional surgery. So that would be good because the doctor would also have visual, direct visualization of the area.
Okay,
So
okay.
they know what to remove and what not to remove. Traditional surgery would also be able to address your lymph nodes, harvest lymph nodes. Stereotactic body radiation won't be able to do this. Now, the advantage of stereotactic body radiation is when the tumor is very near areas of the body wherein performing a surgery would be very difficult. Example, if the tumor is near an artery, or if the tumor is near a vital organ or a major organ, then it would be very dangerous for someone to perform traditional surgery. Most surgeons, 99% of them, will not touch you.
Yeah, they want to
if
avoid.
you have, of course, the patient might die. Once they nick that artery, it's going to be very difficult to control the bleeding. So if it is that case, if you are someone who's not qualified for surgery, then cyber surgery would be considered, would be an option. So this is the case wherein this can be considered.
So I think
so. Another example would be so another example would be for tumors in the brain. I mean, if the tumor is near a part of your brain wherein, say, it's controlling your vision, controlling your speech, or you're controlling your whatever, your capacity to think properly, then surgeons would be reluctant to remove that. So radiation therapy or SRS would be the right approach. But there are limitations. You cannot use this on tumors larger than I believe it's 4 centimeters. Yeah, anything larger than 4 centimeters it cannot be used.
Yeah,
but that was the old guidelines that I know of. I just don't know if it has already been updated. If the requirement was decreased to probably 2. No, so really best to talk to your radiation oncologist about this if it is at all possible. Dr. Jimmy would be able to answer for this.
Yeah, Dr. Jimmy. So
Yeah.
I think to this particular viewer who asked this, if you were trying to find out whether is cyberknife a real medical procedure and that it is valid and that it is effective, I think you've gotten your answer. The answer is yes. It is an effective, it is a real medical treatment system, and it is recognized and is used, all right? And there are many pros and cons to it. Now, whether in your specific case, then you really have to ask your surgeon to give you. And then I hope what we have shared with you gives you some ideas of what questions you can ask your surgeon, right? Again, if you're ever in doubt, you can always seek a second opinion, ask another surgeon, and then you compare their answers, right? And then do a little bit more research. But I think the answer that you can get tonight is yes, this is a real, recognized and it's an effective medical protocol. Yeah.
Okay. Thank you, Doc Jansen. Thank you, Sir Sean. Okay, this will be our last question for tonight. Okay, coming from Ms. Christine Banog. Do we need to worry about previously septated cysts that became solid but the size remains the same?
Oh.
Yes, that is your malignant transformation. Okay,
Oh,
that's a red
wow.
flag.
Okay.
So yeah, that's a red flag.
Red flag.
So cysts are benign. So whether if it's septated or single solid cyst, so inside cysts are fluid. Okay, if it's septated, it just means that you have a one blob separated by a barrier. So that's septated. So it's still benign. But if that septated cyst becomes solid, or if it develops solid components, then that is a sign. That's a red flag. That is a sign of malignant transformation, or the septated cyst already has cancerous components, and the cancer is actually growing. Yeah.
So,
Okay, so that's one example.
So for this particular viewer, the person that has this symptom, please proceed to seriously seek doctor's consultation and advice. All right, and then at the same time, when you have fixed your cancer, when you have fixed your protocols, you can always see Dr. Jansen for either second opinion or to support your whatever treatments that you're going to go through with your conventional doctor.
There you go. Well, it looks like that we've answered all our questions for tonight. But for those of you who were shy to ask questions, okay, don't worry. We can still have we have another Thursday next week and please watch us and ask your questions. Okay. But before we say goodbye to our viewers, I'd like to ask for a very quick parting words from the both of you for our viewers who'd like to start. Dr. Jansen?
Yeah, I start. Okay, so thank you for asking those wonderful questions, very interesting questions. Every single week, we are learning a lot from you as well by asking those questions. So I think a lot of you are my patients, would be patients. So my advice, when it comes to food, okay, so you don't ask this again during the consultations. Food, when it comes to food, for cancer, you have to be on a high fiber diet. You have to eat good fats. Okay? High fiber diet, eat good fats. Make sure you have adequate protein. So where do you look for this? High fiber, that means all plant foods. Just be careful of fruits because fruits have high fructose. Okay, so be careful of them. You can eat fruits, but in small amounts only, and only eat them as a dessert after big meal, not eat them as snacks, okay, or on an stomach. So number two, where do you get your protein? High foods which are very high in proteins would be your legumes, beans, nuts, and seeds. You have to consume plenty of this, a lot of this. Animal food, can you eat animal food products? Okay. My take on this have evolved throughout the years. Now, I say yes. You have to select the right kinds of proteins. No? So animal proteins which are okay for me would be your fish, eggs are okay. Chicken, but the breast only. These three. This is especially for patients who are very, very thin already. Okay, or cachectic patients. Or if you are on chemotherapy, then you have to be on this. This is also especially if you have liver metastasis as well. Okay, very important, right? Then another one would be your good fats. Where do you get good fats? Omega-3. So that would be your fish oil, olive oil. Okay, so those are where you can get your good fats. Seed, nuts, oils sourced from nuts as well. Nuts have high amounts of omega-3s as well. Flax seeds and your algae. Okay, so Simply Nature PPARS is an algae. So you can get good fats from there as well. So what product of Simply Nature has a lot of good fats? That would be your PPARS liquid and soft gel. Those two. Okay. So yeah, so those are what you eat. Things that you have to avoid, important, processed foods, all processed foods. No? So processed meat, so corned beef or tuna, your sausages, etc. Number two would be your processed carbohydrates. So your breads, your pastas, your refined grains, your sweetened beverages, sugars. Honey is considered as a refined carbohydrate. Okay? The artificial sweeteners are also classified under this. So you cannot eat anything or any sweeteners actually. Okay? So another thing that you have to avoid would be dairy. So all derivatives of dairy. So your cow's milk, animal milk, you have to avoid cheeses. So those are the things that you have to stay away from. All right? So I hope nobody asks this again during the consultation, but that's okay. You can ask again if you miss any of the things that I just said. No, but this is the general approach to nutrition. All right. So yeah, there you have it, and I give the floor to Sir Shyan.
Wow, Doc Jansen left me with questions. I'll ask him next week about the change in nutritional outlook and advice for specific, not general, specific cases of cancer. This is why, you know, everyone, the field of medicine is called the practice of medicine. All right, it is a field which is constantly evolving and fine-tuning because our environments are also different from as in different time periods. We're also exposed to different causes of our illness compared to our grandparents' days. You know, toxins, air pollution, and everything is different. In the future, we might have illnesses due to the number of technological appliances in our own homes. You know, I think the radiation that we experience every day today, and if we are now 5G, if 6G comes out, I don't know, maybe when 7G or 8G comes out, the amount of radiation we experience simply because of the technology that's available might be different. So I just want to remind everybody, you know, the medicine is a practice, right? So it's something that we should be excited to see changes and to improve our understanding. And it's a journey that we will go through together. So once again, thank you for joining us today. Thank you for taking us on this journey. You're forcing us to constantly look at the things that we believe in. And you know, when we meet patients with different case studies, different scenarios, we are also learning something, and we fine-tune and we are better able to help the next person that comes along. So thank you again. I'll leave the time. See you guys again next week. So I'll pass the time back to Sheila.
Thank you, Sir Shyan, and thank you, Dr. Jansen. On behalf of our patients and viewers tonight, once again, thank you so much, Dr. Jansen Kalalan and Sir Shyan Lim, for answering our interesting questions from our viewers. And we are looking forward for your answers next week. Now, to everyone, once again, thank you also for joining us and for your questions. Remember, taking actions in your cancer journey is a powerful step forward towards healing and strength. So we hope that you feel empowered and to make informed decisions and to take the control of your path forward. Now, if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving. Keep informed and explore all emerging possibilities and options. So don't forget to like our Facebook page, Simply Nature International, and of course, Dr. Jansen Calalan's Facebook page, and Simply Healed Medical Group. And of course, please don't forget to subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events. Now, just before we end, very few exciting announcements because you asked for it. It's back. We have another round of the 3-day free soft gel capsule if you buy 3 individual packs of PPARS blisters. And yes, that is actually 3,700 worth of Simply Nature PPARS products free. Okay, this is only happening via website and direct orders. And once again, our website is www.simplynature.asia. Now, this exclusive deal kicks off yesterday, August 27, runs today and also up until Friday, tomorrow, August 29. But wait, there's more because this coming Friday or tomorrow, if you buy at least 3,700 pesos via Simply Nature website, that's once again www.simplynature.asia, you can avail the free shipping promo that is only happening tomorrow. So now is the best time to prioritize your health and your family's well-being. Experience the proven health benefits of PPARS at an unbeatable price. Okay, so another exciting event, of course, next week, of episodes of Simply Healed webinar that is happening on September 4, another Thursday, another 7:30 p.m. So please, we hope to see you all once again. So once again, thank you for spending your time with us. This is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. Because your curiosity about your health conditions and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night. God bless you all.